Thank you very much. It's a pleasure to be with you. So we have a phase 3 clinical trial in the United States. That we have an investigative new drug application with the FDA. We got approval for 840 patients in this trial. It's a randomized placebo-controlled study. And we enroll at-risk patients, the highest risk patients, within 72 hours of a positive COVID test. And then we start the therapy, either an active drug or a placebo. And then we follow them for 30 days. Our primary endpoints are rates of hospitalization, admission into the ICU, and deaths from COVID. And it's our hope that we can prevent hospitalization and death by as much as 20%. We expect to have the trial completely enrolled and completed by fourth quarter of 2021, and then file our drug application and hopefully have drug approval either the end of this year or first quarter of 2022. Well, we started investigating developing a new drug early 2021, or early 2020, right when COVID was hitting in March or April. We filed our drug application in June of 2020. We got drug approval and got our institutional review board approved in November. So we really started the clinical trial in late December, January of 2022. And we have about 10 sites all across the US that are enrolling patients. Well, everything we're doing is going through the FDA. So to get drug approval in the United States, we have to go through the rigor of FDA filings. They approve the clinical trials, and we follow the hotspots of COVID around the U.S. So it goes from, for instance, New York to LA, Chicago to Florida, and so we enroll clinical sites, wherever there's active COVID patients. And so the sites we had 6 months ago are different than the sites that we have today. But typically at any given time, we have about 10 sites around the United States enrolling the patients. Well, we don't have a clinical trial in Nepal yet. We're giving it some consideration. But obviously there's an approval process that has to go through in Nepal, similar to the US. This takes time. But that doesn't mean that the patients of Nepal have to suffer. We know we've had nitric oxide technology on the market for the past 10 years. We know it's very safe. We know it's very effective. So the reason we're in Nepal is that we make an over-the-counter dietary supplement, similar technology as the drug, less potent, but we know it has similar effects. So we're in Nepal because we can now offer a product that's commercially available and bring that and use it as a bridge until we get global drug approval. Once we get drug approval in the US, we anticipate that other countries will get approval for this drug, and then we can distribute it worldwide under the care of a physician under prescription. But in the meantime, that doesn't mean that the patients have to suffer. We have a safe and effective solution similar to vitamin D. Vitamin D patients become vitamin D deficient, they become at risk for COVID. Same thing with zinc. So nitric oxide, we know that patients that are deficient nitric oxide are at increased risk. We can titrate their nitric oxide levels up and supplement this in the form of a dietary supplement. Well, the revelation has been over the past 18 months. Number of published studies reveal that, globally, we still have about a 99.7% survival rate. So what is it about this 0.3% of the patients that suffer and that die from COVID? And the clinical and scientific evidence has revealed that it's a lack of nitric oxide. So when patients can't make sufficient nitric oxide, the virus rapidly propagates, rapidly replicates, and makes people very sick. We also know that people with COVID, even post-COVID, have an increased risk of blood clotting. They have kidney disease, they have pulmonary disease, they develop heart disease, and endocarditis and myocarditis. All of that is related to a lack of nitric oxide production. So our strategy is that if we can titrate up and normalize patients' nitric oxide levels, you basically mitigate the risk factors of that 0.3% and make them just like the rest of the population that typically either doesn't get sick from COVID or with mild symptoms where they don't have the lasting effects, what we call the long haulers of COVID. So The scientific evidence, the clinical evidence, the epidemiological evidence all reveal that COVID is really a disease of nitric oxide deficiency. And fortunately, over the past 20 years, we've discovered technology that can combat that. Well, we will do the proper market research and focus groups for what the appetite for cost will be in Nepal. In the United States, we sell this for $75 US for a 30-day supply, 60 lozenges. We anticipate that we can bring the price down in Nepal to make it more palatable and affordable, because we want this to be affordable. We want the masses to have access to this because it should be readily available to everyone. Norvik Hospital is our initial partner. We have relationships with Chairman Basant, and he so kindly invited us and to really discover and to educate them and to teach them more about nitric oxide, to get them to a comfort level that they were willing to partner with us. So they're our original partner, but I think as this progresses, that we hope to have this distributed throughout Nepal and perhaps other partners. But Norvik Hospital is our initial entry because that was our relationship. We arrived several days ago. We've met with several government officials at the Ministry of Health, other government officials, to really for us to understand the process. That if we wanted to do a clinical trial here in Nepal, what is the process? How do we provide them the documentation, similar to how we did in the US with the FDA? And can we do this in a timely manner? Because I think nothing's more important than the sense of urgency to make sure that this technology gets in the hands of not just the people of Nepal, but of people around the globe. And that's our objective, to expedite the clinical trials, to get the drug approved. That way, people all over the globe can have access to the technology that really is revealing very safe and very effective for COVID.